Hello and welcome to Apricot Valley Urgent Care and Aesthetics. My name is Mike Ratliff. I am our family nurse practitioner, board certified in aesthetics. I have with me today Chelly Wells. She is our lash artist here in office, and she's going to model for me while we talk about hyaluronic acid fillers. So, a filler is basically a clear gel. We inject it under the skin to lift and support tissues. So we can go in on the fillers. Let's say that we wanted to change the shape of her nose. We could actually go in with our filler, alter these tissues, and put just a little bit of filler in here to pull this out. We can put a little bit of filler in here to lift out the bridge of the nose. We can put filler in here to lift and shape, and that could give us essentially like a pixie nose, an upturned tip of the nose, something along those lines. Under eye fillers, if you have these deep hollows under the eyes that bother you, if you have the dark circles, we can actually come in with fillers. We can fill the tear trough. We actually run a filler through the skin all the way through this area, and we fill in and create support right here in the tear trough to lift that up in the cheek. We can run it through under the eye, push that fat pad under the eye up to correct those hollows to reduce the dark circles. We can bring it in here and we can fill in the cheekbones. So we can actually contour. Ladies that you like to contour your makeup, you like that nice red blush along here, you want to create that shadow down here, we can do that for you with fillers by running fillers right against the bone through here, lift up the whole face. And when we do it right here, it actually lifts the connective tissue underneath and lifts up the lower face while we're at it. So we can actually lift, reduce down here by treating the mid face. Nasolabial folds. This is a very common thing that people don't like. We can actually come in with our fillers and run fillers right through here and lift that up and change that shadow. We can go into the tissue right here in the corner. We can lift this section up for you, and that'll give you a nice lift to pull all of that out. Chin fillers. We can actually fill the fat pad in the chin. We can fill it right here and right here. Lift this out, contour and pull. We all know we do lips. So lip fillers, we can volumize and plump the lips. We can do jawline. So Chelly's got a nice jawline along here, but if she wanted this out a little bit more angular, we can actually fill in right along the jawline here, bring that out for her, and create that nice angular shape that people like in the jawline. So there's a lot of different things we can do with fillers. This is just touching on the surface. Fillers in hands, if you want your hands to have that more feminine, soft look, if they're starting to get thin, if the tendons and vessels are visible, a little bit of fillers there. Obviously, we've got a lot of areas in the mid face. We can put a ton of filler into the cheek here to build up if we need to. Typically, if I'm doing cheek fillers, I might want to do 5 or 6 syringes to fill here if we're trying to restore volume in the cheeks. Cheekbones, usually 1 or 2, it depends. Our nasolabials, again, 1 or 2. Chin can take a full syringe of filler, sometimes more, just depends on what you're looking for. So your options with fillers are really vast. There's so much that we can do from the jawline to the eyes to good old-fashioned lips we can do, and we are one of the only facilities in the area that will do a full Russian lip. So we can actually do lip shaping, not just plumping. There's the lines here on the neck. These are called tech lines down here. These are very hard to treat. A soft filler in this tech line to lift that up and just volumize these lines is an excellent option for reducing these down. Any type of scarring that you have, we can go underneath a scar, we can lift that up with a hyaluronic acid filler. There's a few areas that I don't like to treat. I prefer not to treat up here. We can, it's just not my favorite. Hollows around the temples, we can treat this. Again, a nice soft filler massaged in here to reduce hollowness in the temple, hollowness around the sides of the eyes. We can actually come in put filler right through here to volumize, put filler in here to volumize. We can have so many of these areas with fillers. The sky is really the limit. It's not just lips. We can treat pretty much everything that you need. If you have any of these concerns, please give us a call. We're happy to set up a consultation for you, go through how much you need in the way of fillers, what would be the best filler for you, how best to achieve the goal that you're looking for. Once again, thank you from Apricot Valley Urgent Care and Aesthetics.